going to request Dr. Ravindran to come in. He's the chairman of Arvind Eye Care, a practitioner par excellence. Besides creating, eye care hospitals and fighting blindness, but he has done it at scale. I think Arvind is one example where it's not a pilot and it is not a proof of concept. They have actually provided eye care which is affordable, high quality, safe, and accessible. So with this, Dr. Ravindran, over to you, sir, to share and tell us about the issues you faced and how you overcame them.
Thanks for this opportunity. I mean, just switching over from a national perspective to an institutional perspective. But still, as an organization, we cover about 100 million population, the states of Tamil Nadu, Pondicherry, Kerala, and Andhra Pradesh. I mean, Aravind Eye Hospitals were started in the year 1976 with about 11 beds. Today, we have about 14 eye hospitals and about 6 community eye centers where we have doctors who man the clinics, and about 80 primary eye care centers which are manned by technicians, which are all in the villages, providing, they are all telemedicine-based centers. With this infrastructure, today we see about 13 to 14,000 outpatients that perform about 1,500 to 1,600 surgeries every day. I mean, it was all started by Dr. G. Venkatasamy with a vision to eliminate needless blindness. The core of his vision is to provide comprehensive eye care to all, irrespective of their capacity to pay. And if you also look at the larger vision of Dr. G. Venkatasamy, it is also about searching out the people who need eye care in the villages. It's not just about people who come to the hospital. And this is in line with the universal health coverage we're talking about as a national goal and also as an international goal by WHO. And this, if you look at the most important thing is how do we enable access for the patients, and enabling access to ensure that in all our hospitals we have both a free hospital and a paying hospital in the same section, and the patients can choose where they want to go and no questions are asked. And again, just to lower the threshold for access, our outpatient services run for about 11 hours. And there is no appointment either for outpatient or for surgery. People who walk in can get the outpatient services, the investigations and surgery during the same visit. But however, if you look at the number of patients who come to the free hospital, among the walk-in, it's only 25%, because the poor patients have a lot of challenges in accessing services in a fixed facility, which is in an urban center. That's the reason why we run about several eye camps. Every day we run about 7 to 8 eye camps. And each of these eye camps is kind of a replica of what we do in the hospital, with all the stations duplicated in a center, because we run it with community participation. We provide the volunteers and all the other support. And we try to provide as comprehensive eye care services as possible in this camp. Transport the patients to the hospital on the same day, do the surgery, and go back to the same village to see them after a month. Last year, we had done about 3,000 eye camps, and we had seen about close to about 500,000 outpatients in these camps, and they performed about 88,000 cataract surgeries. However, if you look at the effectiveness of these camps, they reach only 7% of those who are in the villages who really need eye care. I mean, not the population, but the people who need eye care. And when you look at how many of them access these eye camps for various reasons, it's only about 7 to 8%. If it is in the same village as where we have conducted the camp, when we surveyed, it's about 15%. So as a result, we thought, we have changed the strategy. We have established vision centers or primary eye care centers in the villages. Using technicians, we have duplicated what we have in the hospital as an examination room for a comprehensive eye examination. And we also put in place a teleconsultation platform, and through which the technician as well as the patient can speak to the doctor. I mean, this is just a video. Hope you all can see it. So we have 2 technicians. One person takes care of the administration, registration. It's about 20 rupees. And the technician who's well trained and also had worked at least for about 3 to 4 years in the hospital-based hospital. So because the EMR, so the prescription is sent by the doctor. It gets printed in the center. We are able to dispense the glasses and also the medicines. I mean, we started this, the first center was established sometime in 2004, about 15 years back. That time we did not have connectivity. We had to create our own Wi-Fi network, internet network. And then we also had put up towers for connecting the initial 5 centers to the base hospital. So today we have about 80 centers and now we use the infrastructure provided with the telephone companies. And last year we had seen about 688,000 patients, which roughly works out to about 2,200 outpatients per day. I mean, this is the number of teleconsultations. We have about close to about 20 doctors who provide this consultation. And this covers a population of close to about 7 million people. And last year alone, through these centers, we have done about 25,000 surgeries. If you look at the impact in one of the districts with the base hospital and about 7 vision centers, no patient, no one in that district need to travel for more than 10 kilometers to get good quality eye care. And we also have found that once you set up a center, 90% of the patients who need eye care in a given population, we are able to reach those people within about 3 to 4 years' time. And this has been a consistent experience in center after center. And not only we have done it ourselves, now we have about 80 centers covering close to about 7 million. We also have helped 12 other Indian states and especially the governments to set up vision centers in their particular states. And also we worked with the government of Bangladesh to create about 100 vision centers. And the government of Bangladesh has got a larger vision of setting about 400 vision centers covering the whole country the next 2 to 3 years' time. And we are also trying to use artificial intelligence tools so that the consultation between the base center and to the hospital can be minimized. We have been working with Google in reading some of the posterior segment diseases so that these centers can become much more effective. So beyond these vision centers, we also try to provide, we also give a lot of importance for refraction services. We try to dispense the glasses on the same day of the examination. Every day we dispense about close to 2,000 glasses. Smaller villages where we cannot have a camp or we cannot have the vision center, we send these vehicles also. And again, we also provide diabetic retinopathy screening, similarly using a fundus camera, artificial intelligence technology for the patients who come to the primary health centers. We also have a similar platform for screening of premature children who have retinopathy. These are all done by technicians. And using this telemedicine platform, somebody from the hospital is able to give the consultation. We cover about 22 districts currently. When all this helps in universal coverage and also it meets the need of the community, and as a result, we are able to build the community trust. So as a result, last year, we were able to see close to about 4.6 million outpatients. And if you see, nearly 40% of these patients come through the outreach work we do in the villages. Even though we do an outreach work, we try to make sure that the quality of the work we do is good and the comprehensiveness of the examination we do is as complete as possible as we do in the hospital. And we also have done last year about close to about 500,000 plus surgeries, which translates to about 1,700, 1,800 procedures a day. And not only we do the volume, but we also make sure that we capture all the data of all the procedures we do. And we are also able to benchmark our surgeons. These data shared with the surgeons, and they are able to benchmark themselves amongst their peers. And also, we will also be able to benchmark ourselves with other databases available in the world. Like, here we have tried to benchmark ourselves with the UK database from NHS and also from the European cataract database for the surgical complications. Similarly, visual outcomes, all of that we are able to do it. And this helps us to constantly improve ourselves. And we also knew that the other thing beyond access is also next important thing is how do we make it affordable? We started Aurolab, a sister concern manufacturing unit in the year 1992. to bring down the cost of the intraocular lenses, because we felt that intraocular lenses is the way we need to go if we want to take care of the problem of blindness in our country. And today we have about close to every 10th, 1 out of the 10 cataract surgeries are done using the Aurora product, which are made in Madurai. It is used in over 150 countries, and a lot of products are available for 1/10 of the similar competitive good quality products. I mean, if you want to eliminate needless blindness, we need to go beyond Aravind. I mean, whichever be the institute which does a good work, they need to promote and share the best practices with others. And today we work with about 350 hospitals, nearly 260 of them are in India, so that we are able to provide about 800,000 additional surgeries every year through these institutions, which goes a long way in eliminating needless blindness. I mean, we all need to work together. I mean, if we have to really take care of a larger problem like blindness. Thank you.
Thank you, Dr. Ravindran. I'm sure this was one of the most uplifting presentation, and I think addressed some of the issues that we were discussing earlier when Dr. Indu Bhushan was there, and many of the issues that were raised. Here is an example right here where we have done things at scale, it's affordable, and Kiran, to the point that you raised about ASHA workers, it was the community workers who have made it happen. So I think if we have a will, we can make it happen. And there are people like Dr. Ravindran who are offering their services to this private-public partnership that we had earlier discussed. So thank you, Dr. Ravindran. You know, this is an amazing story. And I must also mention, it took me some cajoling to Dr. Ravindran to be able to say this, because he's such an humble person. And by the way, his slide only talked about 10% market share. It's already up to 12% global market share. So you can have it affordable and still make it into a business proposition across the world. So, you know, salute to you what you have done. A question to you, sir. You've done such a great job in eye care. Do you think the learnings of what happened in eye care, Dr. Ravindran, can this be extended? Do you think it's going to work for many, many issues that we have and the diseases that India deals with?
I mean, like if you take Aravind, where we have succeeded is taking the care to the people. You know, where it's either through the ICAM or through the Vision Center. We are talking about primary eye care. Now, where we have if you take the new model of Vision Centers, now the Vision Centers we are looking at them as an alternative to the ICAM, which we wanted to slowly phase it out. Now those numbers are significantly more than what we see through the ICAM. So Vision Centers sees maybe like 25 to 30% more patients than we see through the ICAM. So where we have this, we are able to do it only because we have a good paramedical workforce, and the well-trained, and we are also able to provide a good quality infrastructure at the primary care level. There's something similar. I think we look at today primary care more at a very general level. I think each specialty, whether it's a cardiology or ENT or obstetrics or pediatrics, they should be able to put together a primary care model similar to what we have done in eye care. And if we are able to provide them with the good knowledge, experience, training, the equipment, they'll be definitely able to do a good examination, share it with the physician at a central level who will be able to guide the patients. Because in our Vision Centers, only 10% of the patients have to come to the hospital, but 4 to 5% for surgery, another 4 to 5% for an expert opinion by the doctor. So what it actually translates, if you see in our 80 Vision Centers, we have saved anywhere between 25 to 30 crore rupees for that community, so which can be spent there. Otherwise, they would have spent that money traveling and paying for all the other things, not necessarily for the healthcare part of it. Right. So I think what we have done in Vision Center, I think it's possible can be done in all the other fields also.
Right. So thank you, Dr.